Hola, ¿qué tal amigos de Super Tejano? Bienvenidos a Informate con Marianela. Today we are exploring a topic that connects health, innovation, and compassion. Imagine, medical imaging. And joining me today, it's a very special person. It's Abel Orendain, owner and MRI tech at Family Imaging Center of South Texas. Thank you for joining us today.
Thank you for having me.
Abel, let's start talking about this wonderful place that you own, and I have the pleasure to be there before. Tell us about how it begins. I mean, why did you decide to open this place?
So, just to give a little brief background on myself, my wife and I have opened up this center where in MRI tech, I've been in MRI tech for the past 25 years. My wife has been an RN for the past 8 years. My father, about 4 years ago, passed away with cancer. When he was diagnosed with cancer, we noticed that a lot of his imaging was done outside of the valley. And that was kind of like one of our concerns, because he was in just so much pain. And for him to be traveling outside of the area to do just basic imaging, really, there was a need for it in the community, that you shouldn't have to go to the hospital. You shouldn't have to wait for any type of imaging that needs to be done. So that was the main driver. As soon as, when my father passed, my wife and I started talking about it. We decided to, I convinced her, I don't know how, but I convinced her to sell our house. So we sold our home, living with my in-laws. Right now it's a circus over there, but, we put everything we could into our company. And so with the money that we were able with the house and everything that we had, we poured into our company and we opened up the imaging center. So it was very important for us to find the right equipment that could encompass for everyone. The type of MRI equipment that we purchased, the type of X-ray equipment that we purchased, right now we're offering MRIs services, X-ray services, ultrasound services. So it was very important for us to have the latest equipment, something that's not old, like your regular, what everybody's used to, and something new, something that can be more accurate than what you would get at any other imaging center.
Now, you just mentioned familia. I mean, this dream started because of your family background.
Yes.
So in the name of your business is family. So what this word actually means for you, and why did you decide to put family in your name?
Oh, that was very easy. I mean, it was inspired by our family. My father inspired us. My father was a very well-known attorney. He was a personal injury attorney in the Valley. He did so much for the community. He contributed a lot of his time with the food bank. He did so many things. And my grandfather also was an activist with Cesar Chavez way back in the day.
Okay.
And so he started the Texas Farm Workers Association here in the Valley as well. So our roots are our family roots, based in the community. And so what we wanted to do was something very similar, try to those are really big shoes to fill on both sides. So we just wanted to try to do something more to help out our community. We've helped out so many patients that it's been truly a blessing. It really has. Part of our logo is our actual family. I have my son and my daughter and my wife and myself are in the actual logo itself. So this whole company is truly family owned, and we embrace it fully.
Those are very important words. If you can describe this center in a few words, what would they be?
Loving, caring. I really don't know what other words to describe it. We just want to make a difference, and we want to help people, and that's all we really want to do. That was the whole point of what we started.
And that's good to mention. I mean, you just mentioned about some of the services. Can you explore a little bit more of what you do there in the center?
So I'm the MRI tech. I do a lot of my scanning there. As far as give you the type of imaging that we do. So everybody, not to get very technical, but you're basing your MRI scanner on magnetic field strength. And so our magnetic field strength is a 1.5, when standard MRIs in the Valley, about maybe 85% of the MRIs are at a 0.3 or 0.6 Tesla.
Okay.
We're at a 1.5 Tesla. And all that means is that we do everything that the hospitals do with their type of imaging, but we do it better and faster.
Talking about the services, you just mentioned the hospital. Do you need referrals from a doctor?
You do.
Okay.
And I'm sorry to interrupt you, but I was going to say a referral is required only because if there's a positive finding, we need to be able to send those results to a doctor so they can explain the results to the patient.
Now, I think we have some video about the machine that you
Yeah,
have there, and
it's
I
awesome.
know yes, it's awesome, the machine, and it's unique here in the Valley.
Great.
Can you talk a little bit more about that machine specifically and what it does?
So it's a wide bore, it's a high field wide bore, and all that means is that the scan times are faster and the image quality is better. So as far as the scan times, all of our MRIs are 15 minutes or less.
Okay.
As far as the image quality is really improved because it uses artificial intelligence. So the built-in artificial intelligence is what makes it faster and higher quality. But what's also awesome about it is even though you're in there for 15 minutes, you're watching a movie. We also put Netflix, Hulu, HBO, anything you want to watch. If you already have a show or a movie you want to watch for the 15 minutes that you're getting scanned, you'll get a comprehensive MRI, still watch a movie at the same time, and you'll be out in no time.
And this is funny that I want to mention. My brother went into the center and he has an MRI done, and he called me like I don't know, several days after. Hey, háblale al técnico y ahí dile qué serie estaba viendo porque me quedé picado. So that's another problem, and they're gonna watch a series, they're gonna watch a movie, and they're not gonna finish,
No.
and so they're gonna want to come back again to do another MRI.
I know, just to finish the show. But not
Yes.
only that, it's a wide bore, so it's bigger than your standard size.
You don't feel like you're
Right.
in
A lot of MRIs are kind of crunched up and they're either right on top of your face. This one is wider on the side, so you have plenty of room, and it's further away from your face.
And
So
it has
it's
light.
and it has plenty of light. And like I said, but most of the time, a lot of my patients, 85% of my patients, or 80%, at least 80% of my patients come in and say the first thing out of their mouths, I'm claustrophobic. I don't think I can do it. I won't be able to do it. I'm claustrophobic. And I'm like, well, let's just try it and let's just see. I'll put a movie on for them. They're watching whatever show, whatever movie they want,
And they get to choose,
and
right?
they get to pick anything they want to watch. And so we make it very easy. We make it very comforting. Marisa's also, she's an RN, so she helps me as well with all my patients. And they get it done. And everybody tells me the same thing. If it wasn't for the movie, I don't know if I could have done it. But the movie really does help you relax long enough to get the MRI
Now,
done.
most of the time when we go, to one of these centers and we do an MRI, there's nobody in the room. In this case, are you allowing some family members, or
do.
there's a nurse? Or?
I do. Well, we're a family-oriented company, so if you're more comfortable having a family member in the room, you're more than welcome to bring somebody in, as long as they don't have any type of implanted devices that would be contraindicated for the MRI. But I always have family members in the room. Sometimes it makes it more easier to do the exam, but I also have Marisa. Marisa helps me a lot, and she'll be in the room with you as well. There can always be somebody there if you need it. We're very patient oriented. So it's all, we care about our patients, every one of them, and we try our hardest to.
That's a good thing
Get
to
'em through.
mention, because some of the times people are very nervous and I'm like, I don't want.
Yes,
Just
yes.
because of that, they don't want to do an
Oh,
MRI.
yeah. It
And
can
it's
be
hard.
You're right. It can be hard. It can be nerve wracking. You're in a lot of pain to begin with, and then to add anxiety on top of your pain makes it even worse. So we try to make everything very accommodating, very smooth and easy for them.
Let's talk about who qualifies for this type of treatment or procedure. Like for example, a person who has marcapasos, or is there any implant, or who?
So
Who can qualify, or anybody can go in?
So the type of machine that I chose a machine that was more encompassing for everybody with implanted devices.
Okay.
A lot of patients that have had surgeries are able to get our MRIs on our system because it's already been tested and braided. You couldn't do with certain implants if you had like a spinal cord stimulator, for example.
Okay.
You wouldn't be able to do that on an open MRI because it's never been tested on open, just to give you an idea. But on our scanner, you are able to do it on our type of scanners. So as long as they're MRI conditional, and I just have to know the information. As long as you give me the information, I can check to verify that it is safe to be on our scanner.
What about costs? Do you accept insurances or private?
We do. We worked really hard to get on all the insurance, most of the major insurances. But if you have any insurance questions, Marisa's always available in the front, and she can always answer those questions. But we do private pay, we do insurances, we do workers' comp, We do attorney work.
Okay.
We work with everybody.
So, and about the services, you also do like for pregnancy test, sonograms?
We do.
Okay.
So
CT scans?
we don't do CT yet. Like
Okay.
I said, since we're family owned, we don't have like heavy pockets. So
Okay.
we're gonna get CT, but we're probably looking at about CT a little bit in a few months later from now.
What about looking to the future, besides of CT scan, what else can we expect about family imaging
Oh
center?
man, there's always so much more. I mean, because I love MRI. This is what I love to do, and I've loved it since the first day I started working in my field, and we're always trying to improve it. So there's always more that I'm looking at for improving the quality out. I'm looking at other AI software that can help you with multiple sclerosis and Alzheimer's. We can still detect it with what we have, but I want something additional to that. So I'm also looking at other coils so that we could start doing breast MRI. There's a lot. There's a lot that I'm trying to do that just waiting for the right moment to be able to get it.
Now, talking about like personas común y corrientes, I mean, we don't understand medical. So how can you explain in easy words the difference between the picture, the MRI that you do to the rest of the body?
Oh, I mean,
Like
that's,
in easy words that we, I mean, I already saw it,
Yes.
but that way people can understand that.
it's like to give you the best example that I could give you. It's like regular television and high definition television.
Okay.
It's that's the difference really. It's just a better quality of picture. You see, there's so much more you can miss on a standard MRI that's a lower field magnet that you're going to be able to see it on our magnet. So instead of the radiologist saying, "Oh, I'm not really sure what this is," they can definitely find out what it is, what the disease is or the pathology is in this case.
Okay, let's talk about your team for a
Okay,
moment. I
sure.
mean,
I love my team.
you already talk about you, your wife,
Yes.
but what about the rest? I mean, who reads the results? ¿Quién interpreta los resultados?
So
Is you or it's
no,
somebody
no.
else?
I have a radiologist. I have a
Radiologist.
couple radiologists that work for us directly. I have radiology groups, different ones I have some local ones and I have some out of the area. It just really depends. They're all special. All of our radiologists are specialized in the body part that they read. So it depends on the type of exam. So I have one that reads like for MSK work. I have one that reads for just brain. It just depends. So everybody is specializing in their field. It just depends on the type of exam that will come in. But I do have a local and a non-local radiologist that also reads full body MRI because we're the first facility that is doing
Tell me
full
about
body
that.
MRI.
I heard about that you
So,
do full bodies. I mean,
that-
anybody can just order that. It's expensive.
Well, so full body MRI, that has been one of my motivations to start our company was because I wanted something that was all encompassing. So that way, I know my father did a lot of imaging before he got sick, and I know him, and I know he would have gotten a full body MRI if it was available to him. He would have been able to do it, no matter what the cost was. He would have done it, and hopefully they would have caught us if it was possible, if it was available to him. They might have been able to catch his cancer sooner. But in this case, I worked very hard with a lot of executives with Canon. Canon is the manufacturer for my machines.
Okay.
And I worked very hard with their executives, and I was pushing and pushing, and I pushed with the applications people. And I'm talking, this took a while, but we finally were able to develop a protocol to do full body MRI. So we do head to pelvis full body MRI imaging. I used to do full body scans when I was working in Austin. They also do them in Dallas. But those type of scanners are a little bit older scanners, and so it would take about an hour and 30 minutes to do. Because of our artificial intelligence that's built in, our scans are done in 45 minutes. So in those 45 minutes, and they didn't have a movie to watch. So here you can watch a movie while you're getting scanned for the 45 minutes that you're in there.
And on those full body MRIs can be considered like, oh, can we do it as a preventive?
It is. It's preventative care. Insurances really don't cover anything preventative. Preventative, you have to pay out of pocket, unfortunately, because insurance are a little difficult with some of that. But it is preventative care, and it can diagnose. We're looking at any type of cancers, any type of pathology, anything that you're not that's not normal to your body, that's what we're looking for.
Like, for example, if I have a cancer history in my family, and I just wanted to be
Yeah,
sure,
absolutely.
I can just go and do that.
We've had patients that have done full body that were only concerned with like their liver or their kidneys, and then they end up coming out with something going on in their brain or in other parts of their body, you know, that they would never have known. So
What about the payments? I mean, do you have like, I'm pretty sure there's a lot of people who doesn't have the money, like just to pay cash,
no, yes,
thousands of dollars,
right.
which I'm pretty sure is not like more than 1,500.
So
Probably.
so full body MRI, the cost can be up to about $3,500, and it can go as low as about 1,600.
Okay.
But we're charging 1,400, and I'm still working with trying to get the price even lower.
Okay.
I want it to be more accessible to more people, so I'm really trying to drive the cost of it down. The issue with the cost is because I have to, a radiologist wants to get paid per body part,
Okay.
and that's why it's so expensive.
So expensive.
And the other companies are doing it at 1,600 to all the way to 3,500. So I'm very competitive with the pricing, but I'm still working on getting it lower. If they say that they know you, if they know your name, I'll give them a
Ya
discount.
saben,
I'll give them
empiezan a hablar.
I'll give them a discount on top of it.
So, and in that case, I mean, do you have any payment plans?
We're working on a payment plan, and we're also working on getting, I believe it's, there's also care credit that we're
Okay.
trying to get on. So, but my main goal is trying to bring that cost down. I'm really just trying to bring the cost as low as I can get it, because I want more people to have access to that. I want everybody to be able to get a full body screening, and hopefully everything comes back normal. But if something comes back abnormal, at least now you can focus on that. And this is just a screening. It's just a tool, like everything else, like your blood work is a tool. Everything, it's just a screening tool. And if something comes back positive, well, then you can discuss with your doctor if a dedicated MRI of that body part with contrast would be needed. And then at least you can start evaluating, and hopefully if it's cancer, they can catch it sooner than later. You know,
That's the main goal.
yeah, once you get to stage 4, it makes it really hard. But if you can get it before it gets to stage 4, that's the ideal.
Okay, for the people who might be asking or thinking about going, where are you located?
Okay, so we're located on Trenton and McCall. We're on Cross Point Boulevard, so we're right on that intersection in Edinburgh. It's inside a medical plaza. So.
Okay. What about the phone number? Do you remember the phone number?
I do. It's 956-420-9536.
Exacto. Sí se lo aprendió. If not, I mean, it's going to be in the screen. We're going to leave it on the screen. Thank you so much for being here with us today. I don't know if you have anything else that you want to add.
I really appreciate the time. I really do. I mean, we've worked really hard. It's taken us about 3 years since my father passed to actually get to where we're at. You know, we've only been open for 7 months, so we're just trying to get the word out to let everybody know we're here. And everybody's welcome to come and see our place and see our machine. I always love to get visitors in and just show them what the experience is like,
That's
just to
true.
get an idea, you know, because there's such a stigma with, everybody thinks, oh, closed MRI, I'm going to be in a coffin. It's like a soda straw, but it's so much different than that. MRI has evolved so much that our machines are so much better. We're doing pediatric patients as well. I'm even doing our youngest pediatric patient, I believe, was 5 years old.
Okay.
And if you can put like a Disney, I
Cartoon.
had some kids watching Lilo and Stitch the other day, and they were loving it. You know, they didn't want to get out of the machine. So
Okay.
if you look on our website, you'll see a lot of information on our website as well. And it's, you know, anything you need to know, just give us a call. We're always available. You know, and our hours, what I wanted to mention is our hours are very flexible.
Oh, yeah, that's true. Even if you call, I mean, if you're after hours, you're available too.
Oh,
on
yeah.
Saturdays too.
Available on Saturdays. We're available on Sundays if needed. We work as late as we need to work, and we come in as early as needed. So lately we've been doing a lot of 8 to 8, so that's been a good thing.
Esa es una gran ventaja. That's una- Thank you so much.
Thank you,
so
ma'am.
much for being here. Thank you all you to be here with us today. La audiencia, muchísimas gracias, and we see you next time.
Thank you for having
you.
us. Thank you.